Dear students, today we are going to discuss cryoglobulinemia. Before understanding the cryoglobulinemia, we are supposed to understand what are the cryoglobulins. Basically, cryoglobulins are the immunoglobulins that precipitate below 37 degrees centigrade. So the cryoglobulins that precipitate below 37 degrees centigrade are called the cryoglobulins. What is cryoglobulinemia? Cryoglobulinemia means when there is usually circulating cryoglobulins found in the blood. This is called the cryoglobulinemia. What is mixed cryoglobulinemia? Mixed cryoglobulinemia means when more than two classes of the immunoglobulins are found circulating in the blood, or cryoglobulins 2 or more than 2 are found in the blood. So this is called the mixed cryoglobulinemia. When we talk about the pathogenesis of the mixed cryoglobulinemia, for example, there is the hepatitis C virus stimulation. What happens because of this hepatitis C virus stimulation? There is B cell clonal expansion. What happens? There is B cell clonal expansion. Because of this B cell clonal expansion, what happens? Non-specific. What happens? Non-neoplastic B cell lymphoproliferative process occurs. Non-neoplastic B cell lymphoproliferative process occurs, and this leads to activity against the Fc portion of the IgG. And this activity against the Fc portion of the IgG leads to immunocomplex formation in the vessel walls, and complement activation leads to leukocytoclastic activity. So this is the brief pathogenesis about the cryoglobulinemia, mixed cryoglobulinemia. Now, cryoglobulinemic vasculitis. What is cryoglobulinemic vasculitis? Predominantly involves small vessels affecting joints, peripheral nerves, kidneys, and skin. So skin, joints, peripheral nerves, and kidneys when predominantly are involved, then this is called the cryoglobulinemic vasculitis. Now, classification. The cryoglobulinemia may be of type 1, type 2, type 3, and type 2 and 3 both. When we talk about the type 1 cryoglobulinemia, so type 1 is a kind of simple type, and the component is the monoclonal IgM or monoclonal immunoglobulin. Basically, monoclonal IgM more than the IgG and more than the IgA. So this is of simple type. When we talk about the clinical features of the simple type, basically there may be the hyperviscosity, there may be the acrocyanosis, there may be the Raynaud's, there may be the gangrene, there may be the type 1 basically presents kind of these things, these clinical features. And the associated disease with the type 1 or simple type of cryoglobulinemia basically is associated with B cell lymphoproliferative disorder. B cell lymphoproliferative disorders may present with the MGUS, may present with the multiple myeloma, and may present with the may be associated with the Waldenström macroglobulinemia. Waldenström macroglobulinemia may be associated with this. So this is the type 1. In type 2, basically what happens? Type 2 is of mixed type, and there is the monoclonal IgM activity. There is the monoclonal IgM activity against the IgG. Monoclonal IgM activity against the IgG, and this is of mixed type. So type 1 was the simple, and type 2 is the mixed type, and the monoclonal IgM activity against the IgG. The third one is the polyclonal IgM and activity, more polyclonal IgM activity against the IgG. It is also of mixed type. And the next type is the type 2 and 3 both are found, means the monoclonal and polyclonal IgM activity against the IgG is usually found. When we talk about the disease associated with this type of mixed type of cryoglobulinemia or mixed cryoglobulinemia, usually the disease associated are the number 1 infection. The disease associated may be the infection. The disease associated may be the autoimmune disease. The disease associated may be the lymphoproliferative disease. When the disease are associated, the infection may be the hepatitis C virus, infection may be the hepatitis B virus, maybe the HIV, maybe the rickettsia, maybe the syphilis, may be associated. When we talk about the autoimmune disease, the SLE, Sjogren, and rheumatoid arthritis may be associated, and other is the lymphoproliferative disorders. So when we talk about the clinical features, the clinical features presented with the mixed type of the cryoglobulinemia, either 2, 3 or 4, may present with these features, like may present with the weakness, may present with the purpura, may present with the arthalgia, may present with the cutaneous ulcer, sicca, Melzer-Triad, may present with the other features like neuritis, may present with the neuropathy, may present with the nephritis. So this can be the presentation of this mixed type of cryoglobulinemia. Now we talk about the renal manifestation of the cryoglobulinemia. When we talk about the renal manifestation, the patient may present with the AKI, the patient may present with the RPGN, rapidly progressive glomerulonephritis, the patient may present with the subnephrotic and the nephrotic range proteinuria. The patient may present with the microscopic hematuria, the patient may present with the nephrotic syndrome, the patient may present with the hypertension. Besides this, basically what happens, the renal injury is the most morbid manifestation. Renal injury is the most morbid manifestation of the cryovasculitis, typically manifested as the immunocomplex mediated membranoproliferative glomerulonephritis. Immunocomplex mediated MPGN is usually found. So these are the renal manifestations. Now we talk about if we talk about the extrarenal manifestations, usually the patient may present with the Melzer-Triad. What is Melzer-Triad? Melzer-Triad is basically purpura, may present with the purpura, fatigue, weakness, or may present with the arthalgia. So this is the purpura, arthalgia, and weakness is the Melzer-Triad. Basically, the patient may present with this. There may be the cutaneous manifestation or skin manifestation. So there may be the purpura, there may be the libido, there may be the ulcers, there may be the Raynaud's, there may be the libido after the cold exposure may present. These are basically the skin manifestation. The patient may present with the neurological manifestation, and the neurological manifestation may be the neuropathy, the peripheral neuropathy may be there, mononeuritis multiplex may be there, there may be the myalgia, there may be the paresthesia. So these are the neurological manifestation. And what are the extrarenal manifestation? The other extrarenal manifestation may be the pulmonary, but the pulmonary manifestation are usually rare. And patient may present with the alveolar hemorrhage, the patient may present with the pleurisy, so may present with the dyspnea, cough. So these are the extrarenal manifestation in cryoglobulinemia. When we talk about the diagnosis, so how do we diagnose? So to diagnose, we are supposed to check the serum cryoglobulins. So serum cryoglobulins are usually checked in respect of the cryocurate. Now what is the cryocurate? When we talk about the cryocurate is the volume percentage. Cryocurate is the volume percentage of the packed cryoglobulins. Volume percentage of the packed cryoglobulins in blood after centrifugation at 4 degrees centigrade. So this is the percent volume of the packed cryoglobulin when it is centrifugated at 4 degrees centigrade. Now what happens? We are supposed to draw it in a pre-warmed syringe. And transported and centrifuged at usually 37 to 40 degrees centigrade. Serum then stored at 40 degrees centigrade, and after 7 days usually the cryoglobulins precipitate out. So this is how we measure the cryoglobulins. And usually what happens, this cryocurate can correlate with the disease severity. So serum cryoglobulins, cryocurate we have discussed. Now besides this, we can do the immunofixation. We can do the immunofixation applied to identify the type of the cryoglobulins. Immunofixation, we are supposed to do the immunofixation to identify the type of cryoglobulins. Now next is the kidney biopsy. We are supposed to do the kidney biopsy. What we see the MPGN plus minus microthrombi may be there. So we usually found the MPGN plus minus microthrombi. Cryoglobulins usually appear as a pseudomicrothrombi. So we usually this found in the kidney biopsy. Now in electron microscopy, we usually found the subendothelial deposits and finger pattern pattern substructure we usually see. So these are the biopsy findings. We Now we are supposed to discuss about some facts about the cryoglobulinemia. Actually, what happens after eradication of the hepatitis C virus infection, we usually are not able to eradicate the disease or cryoglobulinemia, because what happens due to the activity, the production of the B cells, due to the overproduction or activity of the B cells, if we suppose remove the hepatitis C virus infection, but the activity remains same for the cryoglobulinemia. But when we talk about the type 1 or type 2, this is usually associated with the lymphoproliferative disorder, and treatment is based on the type of the disease. So this is usually some points regarding cryoglobulinemia. Besides this, now we come to the treatment. Treatment is usually, basically, we can give the immunosuppression in basically life-threatening condition or organ-threatening condition. We usually can give the immunosuppression. Corticosteroids we are supposed to give as per the disease activity. Corticosteroids we are supposed to give as per the disease activity, or if there are inflammatory changes. Now there may be the role of the rituximab. We can give the rituximab in the organ-threatening condition, or relapses. In relapses we can give the before or after the failure of SCV treatment. We can give the rituximab. Plasmapheresis is usually done in severe vasculitis. We usually in rapidly progressive glomerulonephritis and hyperviscosity we can do the in hyperviscosity, RPGN and vasculitis conditions we can do the plasmapheresis. So this is the treatment of the cryoglobulinemia.